I've been in Heber Springs for 28 years and raised my children here. I love this community and can't imagine living anywhere else, so this is my town. I had been diagnosed with diabetes probably 20 years previously, but we don't have the same technology back then as we do now. He just told me back then, watch your diet. Well, I didn't know what that meant. I was so frustrated because my glucose levels were not going down, but I wasn't eating desserts. So I'm thinking, what else can I do? I'll exercise more. Well, I did, and that's obviously good for me, but I didn't like it, and I really wasn't seeing any results. So many years later, probably 15 years later of dealing with this, my new family physician knew about this program at Baptist Health. Once I started this class, I got so excited to learn that it's possible and it doesn't have to hurt. I continued to cook what we needed to eat and do the portion control. I lost over 20 pounds in 12 weeks. And that wasn't trying to lose weight. The diabetes educational program can give you options in food choices that you hadn't thought about. You want to change your life? Go through the program.
Diabetes is all about self-management. Medications work for a certain amount of time, but diabetes is progressive. We have 3 days worth of class, and each class is 3 hours. And we tend to put them either on a Wednesday or Friday in the mornings, but we will adjust according to our client base if afternoons are better or those sort of things. So 3 days, 3 hours each class. One of the things that I find to be the most important as a clinician is the standards of care. The physician and the patient need to know the standards of care that are put on by the American Diabetes Association, because it's one of the things that helps them to prevent the long-term complications which take away from their quality of life. Standards of care look like getting your eyes checked once a year, getting your foot exam once a year by your physician, checking to make sure you haven't lost any feeling in your feet. Your kidneys, they need to be checked once a year. Your blood pressure, every visit, those sort of things are extremely important for not only the patient to know and put on their calendar, but also their physicians. And in order for you to get into this class, you just need to talk with your physician if you have diabetes, and we need a referral from your primary care physician saying that you do have diabetes and a copy of your lab results.